So what is the ocular surface and why is it so important? Hi, my name is Dr. Joshua Cohen. I'm a board-certified ophthalmologist here at Cohen Laser and Vision Center in Boca Raton, Florida. And today we're going to talk about the ocular surface because the front of the eye is so important, not only for your vision, but also for your general comfort. An irritated, dry, or inflamed ocular surface is going to be really uncomfortable, and it definitely needs to be addressed. So the ocular surface is comprised of three components. The cornea, the clear front of the eye that does a lot of the refracting or bending of the light. I talk about that in my first video on anatomy, which I will link up here. The eyelid, which of course protects the eye, and the conjunctiva, which is the clear skin that covers the eyeball. And we'll talk about each of them right now. So perhaps the most important element of the ocular surface is indeed the cornea. That's the clear front of the eye, and that is what we see out of. Now, everything is designed to protect the cornea. So when the cornea becomes dry, it actually becomes desiccated and almost cracks in little places, and we can see that on the exam. Any imbalance in the tear film needs to be addressed in order for the cornea to be nice and smooth and for your vision to be clear. Now, the top layer of the cornea is called the corneal epithelium. It's about 10% of the thickness of the cornea overall. The whole cornea is only about 0.5 millimeter thick. Now, the corneal epithelium regenerates constantly, and whenever there's an irritation, it heals itself. Now, the cells that grow onto the corneal surface originate in the limbus or the periphery of the cornea. Those are called corneal stem cells. And damage to the corneal limbus due to chemical exposure or injury or infection does limit the cornea's ability to heal. And that is a challenging issue in ophthalmology. And that is very important to diagnose, or else you're not going to heal very well. Now, when the corneal epithelium is damaged, whether it gets scratched off, that's called a corneal abrasion, or whether there's an infection on the surface, that's called a corneal ulcer, it's the epithelium's responsibility to heal in order to bring your vision back to baseline. Now, as I mentioned, any damage to the corneal epithelium is incredibly uncomfortable because of the density of nerves in the corneal surface. And the other important thing to keep in mind when it comes to the ocular surface is any disruption in the corneal epithelium or shape really affects our ability as doctors and surgeons to measure the cornea accurately. Therefore, when we plan for refractive surgery like LASIK or cataracts, we have to really make sure that the corneal epithelium is healthy before we do so. Now, in addition to the cornea, you also have to think about the eyelid. Now, the eyelid obviously protects the cornea when the eyes are closed, but the eyelid does a lot more. It actually supplies the tear film, which is the clear liquidy layer that protects the eye and provides a smooth surface on the corneal epithelium from which we can see. So a lot of our stability in our vision is dependent on the stability of the tear film. The tear film really contains three components. The first is an aqueous or saltwater component that most of it's actually made out here in the corner of the orbit, or the bony housing that protects the eyeball in the lacrimal gland. The lacrimal gland sends out little tubules through the eyelid and therefore lubricates the eyeball. When we blink, those tears are actually pushed into tiny holes called puncta down little tubes called canaliculi into our nose and mouth. So this constant recycling of tear film is very critical in making sure that the eye stays lubricated. Another important component of the tear film is the oil layer, which is made in meibomian glands in the eyelid as well. These are dozens of vertical little glands that line the margin of the eyelid, and their function is critical in preventing evaporation. Think of an oil layer over a lake. Now, damage to the meibomian glands is a very common form of dry eye disease called meibomian gland dysfunction, and that can be due to old age or even due to drug exposures like Accutane, and therefore that needs to be diagnosed and addressed separately. And lastly, there is a mucus layer as well, and the mucus is critical to provide nutrients and lubrication, but also to prevent infection. And the mucus is made in tiny specialized glands called goblet cells that live on the back of the eyelid. Autoimmune conditions can damage these glands, and that can be very uncomfortable for patients and predispose you to infections and scarring. Now, not only is the eyelid function important, but so is its position. Number one, the eyelids need to close appropriately. If they don't, if the eyelid, for example, is too high, that can prevent closure, and that can allow the surface of the eye to be exposed to air, and that contributes to evaporation. That condition is called lag ophthalmos. Conditions that can contribute to the eyelid not closing properly might be a seventh nerve palsy, or a Bell's palsy, or trauma or injury to the eyelid directly. Or the eyelid can be too low. That's called ptosis. That can happen from a stroke or a third nerve palsy. And similarly, the lower lid can be too loose or too tight. Those are called an ectropion or entropion. That can cause the eyelashes to rub against the cornea and cause further irritation and damage to the ocular surface. And all of those problems tend to be addressed surgically. Now, in general, when the eyelid becomes inflamed, that's called blepharitis, and that can be due to a variety of causes, each requiring its own treatment. Treatment with lubricants and sometimes steroids can be helpful, even oral medications if necessary. The inflammation gets so bad that it prevents the glands from functioning properly. That can predispose you to a stye or infection over those glands and follicles, or it can just prevent the meibomian glands from excreting their oil properly, and that's called a chalazion. So in addition to the cornea and the eyelid, the white of the eye, or the sclera, is actually covered by a thin skin-type tissue, a vascular tissue called the conjunctiva. It actually wraps around the eyeball and back around the back of the lid, creating a tiny little pocket called the fornix. So therefore, if you ever lose your contact lenses in the back of the eye, it's not going to float back into your brain. It actually gets trapped in that little area. So it's not going anywhere. Now, the conjunctiva actually stops at the corneal limbus. Now, sometimes due to prolonged exposure to ultraviolet light, that can stimulate excessive growth of the conjunctiva. That's called the pinguecula, and eventually a pterygium, where it does grow over the surface of the cornea, and that often needs surgical treatment to fix. The conjunctiva is very important in providing nutrients, lubrication, and blood supply to the ocular surface, and it's very susceptible to dryness and irritation as well. So when you have conjunctivitis or inflammation of the conjunctiva becomes red and inflamed when there's an infection or exposure to allergies, for example, and that causes the blood vessels to thicken and become dilated, and that's what happens when you have pink eye. Furthermore, with chronic irritation, the conjunctiva can thicken and it can eventually stretch out. And sometimes when it does so, it prevents the tears from flowing naturally to the puncta that I mentioned earlier. That's called conjunctivochalasis and requires a whole slew of other treatments as well. Now, if the ocular surface is functioning properly and all three of these components are working in harmony, then you're going to have your best chances of seeing well. You'll also feel good because the surface of the eye is often the most sensitive when it comes to irritation or eye pain. There are a variety of ways that we can diagnose and address all these different conditions that affect the ocular surface, and we'll talk about those in other videos. So I hope you understand the ocular surface a little bit better now. If you have any questions about what we talked about here today, you can leave them in the comments below. You can also visit our website at conelaser.com and call us to schedule an appointment. So thanks again for your time, and I will see you in the next video.